So we have this patient who has a lot of issues on his face, and you'll be able to see that very quickly. आप हंसो, आप क्या क्या दिक्कत आपको हो रहा है अभी?
मैं तो सामने मतलब कैमरा के जो सामने रहता हूँ तो उसमें वीडियो वगैरह भी अगर शूट करना चाहते हैं तो उसमें थोड़ा सा प्रॉब्लम होता है और कहीं अगर जाते हैं तो पूरी तरह से हंस नहीं सकते।
हाँ, अच्छी तरह से हंस के दिखाओ इन पर, और अच्छी तरह से. So you can see when he's smiling, he's got a gummy smile, incompetent lips, the chin is retruded, he's got asymmetry. So this side's gone more out here, this side is totally in. You can see the depression. So there are multiple issues. Also his teeth, दांत दिखाइए please, ऐसा अच्छी तरह से. You can see the exposure of the gums there. So this is what we call as a complex maxillofacial case, wherein the jaw growth is severely affected. I'm going to show you his scan. One of his joint, his right temporomandibular joint, is also a little bit stubby. It's not as normal as this one. So his left side joint is totally normal. The light open his mouth, but it's not as normal as you would want it anatomically. And then look at this bend here. He's got a weird notching and a depression. The chin is way broad and really behind. He's got a vertical maxillary excess, gummy smile, incompetent lips, white is not fine. So the list of these issues are quite a lot, as you can obviously see. The good news is that all of this can be taken care of in one surgery. And how do we do that? We do this by putting the upper jaw and the teeth in the right position, followed by the lower jaw, along with the position of the condyle, the ramus, the body, and the symphysis and the teeth. So this is pretty much all in one. We can do that. Yes, it's an extensive surgery. Yes, we need lots of titanium plates and screws. Yes, it's going to take us about 5 hours in all at most, and he's going to stay with us for a week because of the recovery and everything. Till the final recovery is probably going to take him even a month before he'll be able to chew well and eat. But here, his concerns, if you really see, are aesthetic or cosmetic, because he's able to open his mouth, he's able to chew, he's able to speak, he's able to breathe, he's able to sleep. Yet, there are so many imbalances in the various relationships of the upper and the lower jaws, the chin and the cheek, the lips, the nose, multiple things. So we're going to try and get all of this sorted for him in one go. We tend to call these face makeovers. Sometimes I add the nose as well. If you had noticed his face earlier, nose also has a slight deviation. He's not concerned about that, so we're not going to do his nose. But in case the patient needs, we could do the nose at the same time as well. So these are basically a procedure that will just give him a new face, a new lease to life. Keep following us up. We try to take you through his journey. And in a week's time, or in about 10 days, if he's going to stay with us, you will see the changes, the improvements, and thereafter. He lives very far from here. आप छत्तीसगढ़ से हो ना? So he's come from 3,000 kilometers and he's come alone. अकेले आए ना? He's come alone, and I asked him, like, नहीं, मेरे साथ इतना दिन, he doesn't have anyone who can take that many days off for his recovery, so he's come alone. We're helping him with his finances a little bit as well, but still, these are major surgeries, and because of that, the whole process is extensive. We've done one scan for him. We're going to be doing 2 more that get his anesthesia clearance and all of that, and then probably scheduling him for surgery tomorrow. Thank you.